Good afternoon, and thank you all for joining us today for part three, which also happens to be the final part of our April Caregiver series. I'm Dr. Wilcox, the Community Coordinator at the New Jersey Healthcare Quality Institute. The Quality Institute is a nonprofit, multi stakeholder advocate for the safety, quality, and affordability of healthcare for everyone. The Quality Institute oversees a statewide community health initiative called Conversation of Your Life, also known as COIL, which is a program of our Mayor's Wellness Campaign. COIL aims to engage communities and residents in crucial advanced care planning conversations. We discuss topics like how to communicate your wishes to your loved ones and healthcare providers, hospice and palliative care, and the various advanced directive documents. Our programming is being adapted to various cultures and languages, and we don't know when a medical emergency or a public health crisis is going to occur. And the COVID-19 pandemic has prompted many people to consider the advanced care directives they may have been putting off. And we just want to make sure that you have all of the information and resources that you need to help you make the decisions about the type of care that you want. We're going to continue to provide resources and have these crucial conversations remotely through digital resources, podcasts, and webinars like this one today. Before we begin, I just wanted to go over a couple of housekeeping items. Please know that this webinar is being recorded and a copy will be posted to our website later today. All phone lines will be muted for the duration of the program to limit background noise, and you may ask questions throughout the presentation and at the end by typing into the chat box or the Q&A box. The topic for today's presentation is living with Alzheimer's for caregivers. And please be advised, it is not the intent of this program or its speakers to provide clinical or legal advice. So I'm honored today to have Robin Cohn, MA, CDP, CMDCP, Director of Programs and Services of the Alzheimer's Association of New Jersey, joining us for today's presentation. And after the presentation, we'll open it up for audience Q&A. So Robin, whenever you're ready, the floor is yours.
Thank you very much, Dapa, and thank you very much to the community for your interest in the Alzheimer's Association, as well as certainly your interest in learning more about caregiving, as well as certainly more about the importance of early care planning. What's important for us to recognize is that caregivers need a lot of support, a lot of emotional support, of course. And what we want to do today is to talk with you certainly about areas that are extraordinarily sensitive, but very important to the work that we do every single day. So with that, I am going to open up our presentation, and we are going to be presenting in two different parts. Dapa, can we see this presentation?
It's not up. I would stop the share again and then.
And I sure will. And I will certainly try it one more time, everyone. And then we should be all set. So this presentation is Living with Alzheimer's for Caregivers. It is a presentation of the Alzheimer's Association. And we present this program as a workshop, really talking about all stages and progression of Alzheimer's disease throughout the entire journey of Alzheimer's disease. What's important for our conversation today is that we're going to be talking about the late stage for caregivers. And we're going to be talking about opportunities to learn more about the concept of self in the late stage of Alzheimer's disease and all other dementia, to be able to best describe different ways to communicate, to connect, and provide daily care for our loved ones in their later stages of Alzheimer's disease. I want to remind everyone that the journey of Alzheimer's disease and all other dementia is a journey that can begin with mild cognitive impairment, progress to early stage where communication changes start to be markedly known and recognized, middle stage where more care and support is needed, and then through the late stage. So someone that is diagnosed today with mild cognitive impairment may actually live well with Alzheimer's and dementia for 15 to even 18 years. What's important in the messaging today in our teaching moments is that we want to be able to communicate with our families here in New Jersey of the importance to care plan earlier in the process, not waiting until the later stage. What's important is to involve the person living with Alzheimer's and dementia so that they can have person centered approaches and a voice for what they wish for their own journey of Alzheimer's disease. So, we're going to be talking about late stage care options and describing ways and how to access those options and how best to really assess and evaluate them. So, as we move forward, we're going to be just talking briefly about late stage symptomatology. And we know that the world as we experience it ourselves is experienced through the senses, the five senses that we learned very early on in terms of vision and hearing and sound and taste, right? All of the senses that we learned early on is becoming so much more profound during the late stage of Alzheimer's disease. We understand that memory impairment, cognitive impairment increases. Remember, this is a progressive illness, that language becomes so much more simpler and basic. We also know that incontinence starts to become an issue. Dependence on our family, on our primary caregivers, or on our family unit and care team increases, and physical abilities, mobility in and of itself diminishes. And again, it's a reminder that if we care plan early in the process, we'll be so much better prepared to be able to help our families in the later stages. So, the traditional views that we have of later stage is that we focus more on physical care management. However, it's really important that emotion, socialization, and celebration of the person really takes part in all stages of Alzheimer's disease. And that certainly care planning is so critical, right? Emotional life of the person, not considered in formal care planning, is really not exactly what we should be doing. We want to be able to provide that personal sense of self. So, we'd like to just share with you a little clip. And Mary, one of our social workers at Northwestern University's School of Medicine, is going to talk to us a little bit more about how the person isn't lost to the disease.
Another common misconception in the later stages is that the person is lost to the disease, that they're no longer aware of their environment, they're no longer aware of the people around them who love them, and I think that is a misconception. While the disease is affecting a lot of these cognitive abilities and maybe has taken away their ability to speak or communicate verbally, they're still the same person. That personhood remains, and we hear about families who will see glimpses of that, who will have moments with their loved one where they knew their loved one knew who they were, and they really connected with them. So I think in the later stages there are these assumptions that the person is entirely gone, and that's not necessarily the case.
And that is really a very important teaching moment for today. It is not necessarily the case. And we have to think differently about the later stages through more of a holistic view, incorporating physical as well as emotional and spiritual aspects of care planning, increasing our focus on the person as they are, and individualizing care and support services. As you probably are aware, there's a lot of stigma with Alzheimer's and dementia. We don't talk about it very often or openly. And what's important here is that if we prepare for the later stages with good care planning, and certainly modifications to that care planning as the person moves through the different stages of Alzheimer's disease, and taking the holistic approach of person-centered care, that will certainly provide us with that structure and with that sense of satisfaction. Living well with Alzheimer's and dementia certainly is a progressive state. And I think that that's really important to talk about. One of my colleagues is going to be emphasizing this a little bit more in this particular clip. So let's listen and we can certainly talk on the other side.
I think the biggest misconception that people have about the self and dementia is that dementia equals a loss of self, and that characterization is inaccurate for a lot of different reasons. First of all, the self is more than just memory, and just because somebody loses their memory doesn't mean that they lose their self. The self is still there, but they just might need some help communicating their self to other people. A lot of times people with Alzheimer's disease will be defined by their current self, so by their self that's impacted by the disease. And what's important is that we remember who somebody's been their whole life, so their lifelong self, and not just the self that's affected by the disease. So if we think about who somebody's been their whole life, and we think about ways to weave that information into every interaction and activity that we do with those people.
So what's important is that if we know someone that, for example, is a nurse and is going through, certainly the later stages of Alzheimer's and dementia, remember that they're still a nurse. They want to take part in their own care, and support, opportunities to be able to have a say. And I think that that's really important to always remember. And certainly personalities may shift in a different direction. What's important is that we remember that the early memory loss that we, certainly experience as families and caregivers, certainly we may, experience that repetition and that difficulty with processing new information. However, someone with Alzheimer's and dementia, their long-term memory bank stays intact for really the progression of the disease. So certainly stories may emerge from a long time ago, and that reminiscence and that, use of five senses is so important. So we do remember that a person living with Alzheimer's and dementia in the later stages, their needs and their caregiving that they expect from us is really emotionally bound in, their recall of years ago. So a lot of the work that we do in our community is to help families to be able to tap in and relearn how to communicate with their loved ones. We may also, realize that there are certain moments of clarity. That happens. It's very interesting. Alzheimer's disease is a neurodegenerative disease. It's a very complex disease. And as we know, it doesn't have any disease modifying therapies that will slow the progression of the disease. However, what's very interesting about our human brain is that there are moments of clarity, and we need to enjoy those moments of clarity. And certainly it may emerge through the use of art, the use of music. We probably are all familiar with, case studies of, people living with Alzheimer's and dementia in their later stages who lost their communication capabilities, but all of a sudden will go to a piano and sit there and play, or play an instrument, or sing, a particular melody. That those moments of clarity are real, and we need to certainly enjoy them as we go through the different changes. We may see that changes are more pronounced. The care role becomes so much more physically demanding on families. And certainly caregivers, if they're left to certainly provide that end of life care, they may end up making all, the care decisions. However, if we make those decisions early on, we know that we're doing the best by our loved one, right? We're following their wishes. And caregivers really become advocates for care. And certainly with our work at the Alzheimer's Association, we talk with families, we provide those care and support services, and we teach different strategies and communication strategies to really help families to certainly move through this process. And of course, we're always talking about the importance of caring for our caregiver. So let's listen to one of our colleagues as well.
My dad is, he's an interesting character. He's very type A. My father is one of the most decorated living Vietnam War veterans alive today. He's a retired colonel and very patriotic. My mother would say he was a stud. I mean, he's just really strong in character as well as and physically. And the stress of dealing with all of the decisions and the impact of her behavior, the impact of having her with them, displaying this behavior over months and months has actually really impacted my dad physically, to the point where I got married last year, and my husband has yet to see the dad that I grew up with because he's actually having some health problems that I know the stress of this disease have had on my dad. And my dad's my very best friend. So it's amazing that something that impacted my grandmother, who meant the world to all of us, has actually had such a huge impact on this guy who is just rock hard. It's been really difficult.
This is very important, and we could talk on the other side about this, but it's very important to be able to take care of ourselves as caregivers and to realize that self-care is so important. And there are many data points that talk to the fact that caregivers may pass before their loved one because of the caregiver stress, because of the physical demands. And certainly it's very difficult, especially people today that represent our sandwich generation, caring for their own families, caring for their parents, and certainly just having to make all of these different accommodations. So early care planning is so important because it provides that base, knowing that you have everything in order, and that will certainly help with stress later on. And we certainly talk about the importance of living well and making sure that we care for our caregiver. In terms of communication channels, we know that someone living with Alzheimer's in their later stages, that speech, certainly becomes much more difficult. And certainly your loved one will communicate with you in nonverbal ways. So we teach our caregivers about learning different ways to be able to connect with our caregiver families, with our loved ones, to be able to make sure that we're caring for the person in that particular moment and can really synthesize what it is that they need. So it's almost as if we teach often about communication decoding, making sure that we're able to provide the care and support through the communication channels that we experience as caregivers. So let's listen to one of our other colleagues about these changes.
What we learned from the experts is that a person's sensory abilities are still intact. So you can do a lot of things with them and engage them, such as a hand massage or aroma types of therapy, or playing a favorite song, or singing to them, or reading to them. So there's all sorts of things you can still do, even at the very last stages of dementia.
And that's very important. Communication is so important. And we communicate often with the person in other ways, not just through verbal communication. Certainly, we talked about the senses, facial expressions. Remember that the person living with Alzheimer's, they have an emotional connection that they want to be able to feel. So through touch, through sound, through body language, through just that smile that we have on our faces, through certainly looking at our loved one eye to eye, and just connecting in different ways is so important. And then, of course, spending time together, not missing a moment. You know, we all went through this pandemic in the last year, and it's been so difficult for everyone. So I know that we could all appreciate the importance of spending time with our loved one. So again, let's listen to one of our colleagues.
In the late stages of Alzheimer's disease and at the end of life, I think one of the things that can be most difficult for caregivers is to know how to spend time with their loved one. How can their time with their loved one still be valuable, even without the ability to connect through language? People in the late stages still respond to touch, they respond to smell, they often respond to music. So in the late stages, I think it can be helpful for family members to remember what their loved one used to really enjoy. Perhaps there was a song that was their favorite song, or perhaps there was a lotion that they really loved. And when you go to spend time with them, play that song or simply hold their hand.
Very important. And of course, identifying family and friends may become more difficult, but there is recognition. Knowing that someone is important to him or her is very, very common. They have this sense that they know you, that you're familiar to them. And of course, just, accentuating the point that the world is experienced through our senses. And we as caregivers, and certainly as providers and practitioners and professionals in our fields, should always recognize the importance of using our five senses. Very important. Significant feelings of grief are very normal, but it's still possible to connect. And of course, touch is very important. And we want to, of course, always talk to our families about that. We also have programs on meaningful activities for our families to engage with their loved one, enforcing different types of focuses on communication channels that really resonate with your loved one is so key. Incorporating music, we just heard about music, spending time outside, and always learning how best to modify the different activities in order to have participation, like putting together flowers, putting together, any type of, arrangement, or just, sitting together and enjoying your time together is so important. So let's listen to also one of our colleagues who are going to be talking about meaningful activities and how we incorporate that into our educational programming.
There's a lot of anecdotal evidence out there about music and its value with people with Alzheimer's disease. Now, I'm a former music therapist, so I happen to really have strong feelings about this, and of course think that music is a wonderful intervention, not only for people with Alzheimer's, but for most people. But some of the things that are special about music, first of all, music is processed not just in one part of the brain, but all over the brain, because it involves words and memory. It involves rhythm. It involves long-term memory, because when you hear a song, think about it. You often will think about where you were when you first heard that song, or people that enjoyed that music. So on a lot of levels, music can be very therapeutic. When I was a practicing music therapist, I would use music therapy in many, many ways. One was to help people to remember their past. So if I could tap into songs and music that they had strong memories associated with, it could be incredibly powerful. Another way would be to almost manipulate people's moods a bit, because often, what the anecdotal thing that you hear out there all the time is that if you want to calm a person down, you put on calm music, and nothing could be further from the truth. A little music therapy trick is that if you are working with someone who's quite agitated, you want to play loud music that gets their attention. So loud music with a very heavy beat to get their attention, because it's meeting the person where they're at. And then you slowly go to music that's softer and softer and softer. And if you're skilled enough, you can actually use that to calm people, or conversely, to help to stimulate people.
And that's very important advice that we talk with our families about. And certainly including your loved one and providing care is very important. We also teach about having your loved one imitate your actions. So we're always talking about modeling, guiding our hands with theirs, talking through the process of what we're going to be doing, and certainly using different hand over hand techniques. So there are different ways in which to provide care that we talk about all the time. And remember, during this late stage, your loved one may need 24/7 hour care. I want to remind everyone that the Alzheimer's Association has a community resource finder repository of all services that are available at the local level. If any of our family members are looking for home care options, home health care options, we can provide them as well. And certainly, we're talking more about long-term care and adding on additional services. However, please remember that if you plan early, then what you're doing is that you're just starting to really implement what you've already care planned for, knowing that your loved one is part of the process. We are always talking about communications with healthcare providers about any changes that families may see or experience with their loved ones, such as behavioral changes, some, changes that are more physical, that certainly, are cause for concern, those signals that you get. So we're always talking with our family members about speaking with their healthcare providers, expanding your care team as well, and focusing on quality of life. That's what's so important. And again, as we're talking through the process of early care planning and end of life decision making, we're always advocating for honoring the wishes of our loved ones with Alzheimer's disease. Person-centered care is just so important to the work that we do. And as you probably recognize, there are a number of physical changes that take place. It could be weight and certainly difficulty with processing foods, swallowing difficulties. It's really important to work with your healthcare providers as well as your entire care team. And certainly, being, knowledgeable about Alzheimer's and dementia, knowing what to expect next, and then also finding different ways and to be able to bring that nourishment to your loved one that certainly may be having more and more difficulty. Because remember that the brain is the control center of our entire body. So when we talk about Alzheimer's disease and dementia as being fatal, that is true because all of our systems may shut down. Now, certainly a person living with Alzheimer's and dementia may have other comorbidities, and certainly we could talk about that when we have our Q&A and conversation with community. However, it's important to recognize that, our systems that do start to shut down are really, an area that we have to prepare for, right? Also, there are physical changes that affect the person's ability to move, changes in maybe their gait or their balance, mobility. The person may be more at risk for falls. I just spoke with a family just the other day who unfortunately his wife is falling. And, that's creating, obviously they're starting to see more market changes of impairment in her. And, they know that she needs more help and care and support services, as well as, maybe, using other types of objects that might be more helpful to them as they, try to enjoy, their favorite food. We talk about using different types of utensils, different types of maybe grasping objects that maybe, will be more helpful to them. But certainly the most important point is that last point on our slide, sitting and smiling. And that is so important because that emotional care and support is everything. And of course, you know that there is sometimes incontinence that takes place maybe earlier in the process than we expect, but our ability to know how and when to be able to intervene and help people, certainly with those experiences, how embarrassing that may be for them, especially as they're moving through maybe the middle stages of Alzheimer's disease, but it's not if you're prepared for it, right? So you always want to be able to work with your care team and your healthcare providers to ensure that there are no other causes of a person's incontinence. And you have to look at all of these changes as just part of the process of, certainly providing that care and that comfort during the later stage of Alzheimer's disease. So we always talk about different ways to communicate with our healthcare provider team, albeit different types of infections such as UTIs that may present itself, changes in weight, appetite, and thirst. This family that I was just talking to the other day, he was just telling me that, his wife has gained weight. And that's because, she's just starting to enjoy all these foods that perhaps, she just wasn't enjoying earlier on because, maybe she was just more cognizant of, her weight, for example. But, what's important here is to know that these changes take place and to provide, certainly, good experiences with these changes. We always say information, education, and knowledge as caregivers helps us to be able to support our loved ones. And understanding and expecting these changes are really important. So just as a reminder, the different, symptoms to report to your healthcare providers, certainly any imbalances or mobility changes that your loved one may be, showing in terms of maybe nausea or cramping or lightheadedness. We're always looking for fluid and electrolyte, imbalances. Your loved one may be more at risk for pneumonia or UTI. So we always want to report that out to the doctor. We're always talking also about bed sores and pressure sores. They're very painful. So, what's important here is that we recognize all the different changes that take place, not only cognitively, but physically, and that we're prepared by having a healthcare team, home care options, different care providers that will provide those services to your loved one. That's what's really important in our conversation today. So certainly the behavioral changes are, they vary from person to person. Someone may start to scream out in the middle of the night. Maybe they're having hallucinations or delusions. They may become much more agitated or aggressive. So besides the physical symptoms that we may be experiencing, we want to make sure that we report out to our care team these behavioral changes. And the behavioral changes that take place in the early stages of Alzheimer's that caregivers experience, such as perhaps, just that agitation, certainly they could be modified, and we have certainly skill sets that we teach our caregivers. But as it progresses throughout the stages of Alzheimer's, it's really important that we inform and educate and treat, these behaviors differently. And with the help of care planning, we're able to do that. And just a reminder that the medications that are available for Alzheimer's disease, again, are not disease modifying, but they may help with some symptoms. Now, we're all familiar with the cholinesterase inhibitors such as Aricept or Namenda for more moderate to severe Alzheimer's disease, or, a combination that was actually put on market in 2014, long time ago, right? For moderate to severe Alzheimer's disease. Again, they may help with some signs and symptoms, but they're not curative or disease modifying. So let's just listen to Dr. Peterson as he talks through this.
A more vexing problem that can occur in the setting of Alzheimer's disease is the situation that involves with paranoia, delusional thinking, someone stealing money from me, taking my purse, taking my personal goods, or actually aggression. This, in fact, can be such an important factor that it may affect the person's ability to remain in a particular living situation. That is, if the person becomes dangerous to him or herself, dangerous to the other residents in the facility or to the staff, sometimes the person has to be moved. So these are very difficult problems to deal with, and the medications are only partially effective. Generally, we'll be talking about drugs such as antipsychotics or so-called neuroleptics, like the more typical ones, haloperidol. Sometimes the newer ones, such as olanzapine and quetiapine, can be effective in this situation. However, the data in the literature indicate that there's very little hard evidence that these medications actually are effective in the setting of Alzheimer's disease. In addition, for example, with the atypical neuroleptics, there's a so-called black box warning in the PDR, meaning that these drugs actually may have serious side effects, such as increasing what's called all-cause mortality, death, in these individuals if you use them in an unsupervised fashion. So the bottom line with regard to the use of these drugs, these are very serious behaviors that have to be managed one way or another. If behavioral manipulations have not been effective, we might have to turn to these medications. But in these situations, it's incumbent upon the physician to have a discussion with the patient and the family so they understand all of the risks, all the potential benefits, use these drugs at a very low dose, monitor them very carefully, and of course document everything in the medical record with respect to these discussions. The risks and the benefits have been weighed in using these medications.
So certainly monitoring care is so important with your loved one in terms of increasing mobility problems, with more rigidity, more restlessness and discomfort, changes in sleep. Either way, either sleeping all day or not sleeping at all, and then the onset of, breathing issues. So challenges in the late stages, which we talk about as expanding our care team, there may need to be other providers and specialists that are brought in to the care team to be able to evaluate and to manage any discomfort. And what's important as well is to keep your loved one very healthy in terms of, just skincare, certainly, maintaining, motion, keeping the person moving, keeping them clean, certainly with, vaccinations, and, of course, always being in communication with our healthcare providers about basic functioning and changes. And of course, we have to prepare for crisis. And, we need to be able to, and I can't emphasize this enough, early care plan. Communicate with care partners is so important. We need to have a plan for who to call in the event of a crisis. We need to better understand DNR orders. That is important. Certainly, we just had our decision day, right? And we're talking about different choices that families have regarding treatment that may need to be made, but they need to be made early so that your loved one is part of that decision making. Advanced directives, if needed, guardianship as well, arrangements. You don't want to go there. You want to have every plan in place. And always remember that you can't do this alone, right? So let's listen to one of our care community members, Kitty, and she'll talk to you a little bit about this.
Advice that I would give other caregivers if they're caring for any individual with any type of disease, but mostly Alzheimer's, is to really make sure that they take a portion of time for themselves, because it can become all-consuming. And if you're not able and on the spot, you're not going to be able to provide the care that's so desperately needed. So the idea of providing care for yourself as well and finding time for yourself, respite care for yourself, is very, very important. Unless you are able and healthy, you can't provide that for someone else. It's not an easy job. And it is a 24-hour, 36-hour-a-day job.
And we talk about this with our families all the time. So in summary, please remember that the sense of self for your loved one is so important to recognize. That person-centered care, contacting the Alzheimer's Association, coming to our classes, learning more about understanding Alzheimer's and dementia. We'll teach all of our caregivers and our families about communication, about care and support that may be needed. And we provide certainly self-care strategies for all of our caregivers and our families through our support groups and certainly our social engagement types of programs. So with that, I will certainly stop screen sharing and we could have a conversation.
Perfect. Give me one moment.
Absolutely.
So I do want to say thank you for all of that information. And before I open it up for audience questions, I just wanted to give a quick reminder that a recording of this webinar will be available on the COIL webpage so that you can review all of the information that was discussed that you may have missed, and you can also share it with your family members and friends. And we have other resources available for you as well, such as our advanced care planning, preparing for the unexpected one-pager, where we've compiled trusted resources that are all accessible from home to help you and your loved ones start thinking about your wishes and strategies for how you can comfortably approach these important conversations with one another and your healthcare providers. So we encourage you to take a look at this document and share it with your family and friends, and stay tuned because COIL will continue to push out resources such as one-pagers and webinars for residents and healthcare providers. So tomorrow also, you will be receiving an email with plenty of resources and tips for caregivers of patients with late-stage dementia, as well as a link to today's recording. So while I'm going over a couple of questions, if you have any questions for Robin, please feel free to type them in the chat box and we'll get to as many as we can in the time that's allotted. So I did hear you briefly mention advanced directives towards the end. Would you be able to give us a little bit of an explanation of what an advanced directive is for those that are unaware?
Oh, absolutely. And, what's very important as well is that, early on, as soon as a diagnosis is certainly obtained by the healthcare provider team, we have to start to have a conversation about honoring our loved ones' wishes. So a person with dementia certainly has their own legal right to limit, to refuse, or stop medical treatments. These wishes are usually expressed through advanced directives. So these are documents that specify the type of medical care a person wants to receive once she or he no longer has capacity to make such decisions, and who should make those decisions are part of the legal documentation. Advanced directives should be made when the person with dementia still has legal capacity. That is very important. And this is also important to remember for everyone, the level of judgment and decision-making ability needed to sign those official documents, right? Or to make medical and financial decisions are intact. These documents we're always talking to our family members about should be completed as soon as possible following the diagnosis of dementia. And the Alzheimer's Association could help certainly with identifying elder law attorneys, with providing more information, and certainly, resources all around the importance of advanced directives. And if advanced directives are not in place, the family must be prepared to make those decisions. However, consistent with what they believe the person would have wanted while acting in that person's, their loved one's best interest. And of course, we always talk about law in terms of state laws. They may vary by, state to state. And, when we have our programming that is, specific to legal and financial planning, we're always talking about state law because New Jersey, New York, Pennsylvania, it could be very different, right? So we want to make sure that our family members are, the spouses of our loved ones, adult children, they also may have the right to make the decision to stop medical treatments if no advance directive exists. So, certainly we want to make sure that all of our family members understand the different types of advance directives, whether it be a living will, a durable power of attorney for healthcare. And all of this information is on our website, alz.org/care. And certainly just by calling our helpline number at 800-272-3900, we can provide those resources and services to everyone. What's important as well, Daba, is that families discuss advance directives because we want family members to understand, respect, and as we talk about in our communities, right, about abiding by their wishes. So to discuss these wishes and work out any family issues or disagreements, right? There's a lot of families that have, sibling conversations that really need to be, certainly mediated, unfortunately, if they're not dealt with at the early stage. That is important. They also, advance directives, they should be discussed with your healthcare provider team, right? To ensure that they're aware of their wishes. So I'd like to hear if anyone has a question around that, but this is really important conversation.
I agree. So yes, if anyone does have questions around that, please feel free to type them in the chat box. But I did want to touch on the importance of having these conversations early. And many people have tried to encourage their loved ones to complete an advance directive, but they're often met with resistance from their loved one. They don't want to talk about it. So I wanted to know if you had any experiences or any different approaches that may work better, because we always want to make sure that we have these conversations and fill out our advance directives, especially when a family member with dementia has legal capacity before it's too late. So I wanted to know if you had any specific.
Well, the Alzheimer's Association presents education on this particular, area. And if we continue to mainstream these conversations in everyday living, I think that that's what's important. And I know that through Conversations of Your Life, that there's opportunity to have those community conversations and to be able to really address any community members' concerns. And I really believe that education is empowerment. So if you better understand what it is that, certainly that we, should be doing in the early stages, and realizing that, it's just part of life. And that without these documents, what you're doing is that you're providing more stressors on your family later on. And as Alzheimer's and dementia, it's such a complex disease arena that, just having, that basic mainstream information exchange, conversation, education, and information among all of our community members, will, just kind of, I would say that it would lower those barriers that sometimes that we have up, where we're afraid to have these conversations, because you don't want to wait to the end when somebody says to you in a healthcare setting, well, what is your goal at this point in the care and treatment of your loved one? Why are we waiting until 48 hours before end of life? Why not have those conversations 15 years earlier so we know what that plan is? When you know your plan, you're able to be so much more, I believe, of going into that role of either being that caregiver, that spouse, that daughter. You're able to stay in that role, right?
Yep.
I think that that's really important.
Thank you for that. Oh, we do have a question. Yes, the session will be recorded, and tomorrow you will receive an email with the link for the session, and it will be uploaded to our website later today, which is www.njhcqi.org. So,
And I also want to mention, Daba, that we had provided a guide, tips for late stage for caregivers. And you'll find that there are tips that really walk through, certainly the five senses and walk through, these concepts that we've been talking about. And also we have resources and brochures. You could always contact the Alzheimer's Association. I know that Dapa, you'll provide all that contact information for everyone.
Correct. And we still have a couple of minutes. So I know earlier during your presentation, you were talking about patients with Alzheimer's and dementia. They have moments of clarity through the use of arts and music. So I just want to know, is there ever a bad time to start the conversation? So say you didn't have an advance directive or care plan in place, but they're finding themselves in through this moment of clarity. Would that be a bad time to have the conversation, or is there ever a bad time in your mind to start these conversations?
I don't think that there's ever a bad time, but I would certainly say in the early stages when a person can voice what their wishes are is so much more important, because those moments of clarity don't always happen. And you want to use those moments of clarity to enjoy sharing music together, sharing, your life together. You don't want to have those heavy decisions at the very end of life. And, as a society, we certainly still tend to make those decisions when it's too late. We have to make them early, because one story that I did hear was this wonderful daughter who was saying to her family member, it's like going on a trip. We have to know what we need. We have to pack. We have to get ready, because we're a team. And I think it's really important that people feel that they have the information, the education, certainly the care and support that they need. And when they're able to make those decisions, it's so much better for family members, right? And it's better for the health systems, right? As well as our society, of course. So, having these conversations are no longer, if I may say, taboo. I believe that they really are important. And we at the Alzheimer's Association, we're trying to mainstream these conversations so that, it's not scary, it's not frightening. And certainly earlier is really the operative here. Very important.
Agreed. And we do have a question that just came in. When is guardianship required, especially if there are medical and durable power of attorney as well as pulse forms in place?
Well, certainly it's about capacity, and what we, having a question around whether a person is legally capable. When that starts to surface, I think what's really important is if you have all of your documents in place, then you are well prepared. But what we always talk about with our families as well is that you don't want to get to that point, right? You want to be able to speak with an elder lawyer to make sure that you have all of your documentation in place so that you don't get to the point where legal capacity is being questioned, and then it becomes an issue that starts to reside outside of that family, right? Unit. That's important to recognize as well. But I do encourage everyone to speak with their elder lawyer and, have those conversations. Do I have everything in place? Is there something else that I need? And also to remember that we need to update those documents. That's important, especially when there's life changes. We hear from so many families where, things happen in families, right? There could be, deaths, there could be changes just in the dynamics of a family unit. So, those changes need to be recognized. There was one example of a woman who, had all of her documents with her husband. Well, her husband now has Alzheimer's disease. Who's going to care for her? So everything really just needed to be, obviously changed. And she just did not recognize that that was even going to be an issue because she was so, concerned about her own spouse and not recognizing, well, what about myself?
Thank you for that. And we do have time for one more question. I don't know if we'll be able to fit it all in, but I just wanted for all the caregivers and people on this on this webinar, on this program today, just to know treatment options. So what's the difference between hospice and palliative care? And when would a caregiver know when to put their loved one in either treatment program? I know you had some information on it in part 2, but we weren't allowed to get to that today. So I just wanted to just briefly touch on that. I know we could talk about hospice and palliative care for quite some time.
Oh, absolutely. And as I shared with you, Dapa, we've been talking about this for years, with the provider as well as certainly our communities. And palliative care is really supportive care. It's comfort care. So instead of seeking a cure or trying to prolong life, comfort care focuses on dignity and quality of remaining life. That's important to recognize. It aims to keep our loved ones comfortable, pain-free, until life ends more naturally. And it doesn't mean that we withhold all treatments. A person can continue to receive any necessary medications for chronic conditions such as blood pressure, diabetes, as well as certainly, pain, medications. And what it does is that it eliminates unnecessary procedures, unnecessary tests, and medical treatments. It's best supportive care, making the person have good quality of living without that intervention that could potentially make them experience side effects and, other debilitating, experiences. Hospice programs provide comfort care to those in the later stages of a terminal illness, while also offering support for families. So care can be provided at home or in a healthcare system or residential care, facility. The hospice team is comprised of the healthcare provider, a hospice nurse, a social worker, maybe other, nurse providers, could be spiritual, as well as trained volunteers. They all work together to address the physical, the emotional, and the spiritual care of the person as well as the family. We know for Medicare to cover hospice care, a healthcare provider must note that the person has 6 months or fewer months to live. Benefits can be extended if the person lives longer than expected. The Alzheimer's Association certainly can refer to hospice services in our area. And that's important to recognize. Palliative care is best supportive care. Hospice is different. And you're not giving up. So many families will say, I'm giving up because I'm not seeking, that curative, medical treatment, right? But it's making the person enjoy their life. And you could enjoy their life. But, certainly talking about palliative care, talking about certainly hospice care earlier on, right, is all part of that planning process that we certainly like to inform and educate our communities around. Very important.
Perfect. Thank you. So I just do want to say thank you all for joining us again today. And Robin, thank you and the Alzheimer's Association for partnering with COIL on this third part of our Caregiver series. And I just want to remind everyone, well, after this program, you will be receiving a survey. If you could briefly fill that out, and just be on the lookout for the email tomorrow with the webinar recording, as well as all of the handouts and PDFs that we discussed for resources for caregivers with patients and loved ones that are dealing with late stage dementia or Alzheimer's. So thank you, Robin, for all
Thank
that.
you very much.
All right. I want everyone else to take care.